Hi. So, sorry, I look like garbage, but because I'm tired and I don't, haven't done anything, no makeup, no nothing. So, here's the real deal me. I'm actually jumping on here because every year for the past few years for Legislative Fibromyalgia Advocacy Day, I run population ratio statistics in the US and by state to identify the population ratio or percentage of people in the United States living with fibromyalgia. And then I do a separate projection for veterans and how many veterans have fibromyalgia. And these are approximations based on the last US consensus. So we have, well over 300 million people in the US, and research, the most latest research in 2018 indicates that 3 to 5% of the world population has fibromyalgia. So applying that to the US of 334 million, really just a few people shy of 335 million, doing a 3 to 5% projection, that is a little bit over 10 million to just under 17 million people in the US have fibromyalgia. Then when I look at veterans, right now, approximately 1,900 million veterans are in the US. This is actually a drop from 5 years ago. 5 years ago, we had about 22 million. So as I'm looking at the numbers, I was like, okay, so in 5 years, we've lost about 3 million veterans. So I went to look at what years per year, how many veterans passed away. And from 2019 through 2022 is when we lost the bulk of our veterans of that 3 million. And some of it's due to age and illness and whatnot. But, when I'm looking at the projection of how many of these 19 million veterans have fibromyalgia at a 3 to 5% population ratio, we're looking at 570,000 to 950,000 veterans with fibromyalgia. The interesting part here is that 5 years ago, we had more veterans, but the projection was lower in 2018 of how many veterans had fibromyalgia. So why all of a sudden this, what seems like a potentially inflated false increase of veterans with fibromyalgia? And actually, there is a justifiable reason. So since 2018, we are seeing heightened public awareness and advocacy initiatives for fibromyalgia. The other thing is, although the healthcare system and medical providers are still behind the curveball of understanding fibromyalgia, we have more now that understand fibromyalgia than we did 5 years ago. So having more providers have that heightened understanding helps them to identify better which, of their patients potentially has or does have fibromyalgia. The other thing is diagnostic assessment and tools have improved in the past 10 years and past 5 years. And so the heightened awareness advocacy, along with the increased understanding and education of medical providers, leads to better diagnostic assessments of patients. And we see this with populations of people where all of a sudden they'll say everybody has fibromyalgia. And it's not that all of a sudden everybody has fibromyalgia. It's more of we have better testing or assessment, diagnostic assessment tools for a lot of illnesses, including fibromyalgia, and then heightened understanding, awareness, and education amongst the general public and medical providers and health systems is why you will see more people diagnosed with fibromyalgia. It's not because all of a sudden everybody has fibromyalgia, or all of a sudden we saw a huge increase of veterans with fibromyalgia, because 5 years ago, it was estimated about 650,000 veterans have fibromyalgia, but now we're seeing a 570,000 to 950,000 on a 3 to 5% population stat. So yeah, and this is common with so many medical conditions when there is increased public awareness, which leads to increased understanding, along with engaging in like healthcare advocacy and awareness initiatives and legislative advocacy, along with partnering with healthcare driven organizations and patient driven organizations and medical providers alike. This leads to a heightened understanding of fibromyalgia and what tools are available for assessing and diagnosing. And this is another key point as why it's so important to partner with patients, because a lot of times we are the experts on the illness and how it affects us, and then we have access to a whole bunch of fibromyalgia communities through the internet and through social media, and so we can see visually within our communities how many of us there are. So yeah, I just thought I would share that because I found it interesting that despite as far as military veterans with fibromyalgia go, despite the fact that we've lost approximately 3 million veterans in the past 5 years, the incident rate of fibromyalgia amongst the veteran community has gone up. So that's all I got. All right, well, there's my nerdy moment. Hope you all are doing well. And until next time, make your self-care your #1 priority. Love yourselves and love each other.